Well, we're live, supposedly.
They see your face right now?
I don't know if there's anybody on it. I'm not sure. Don't know. Can't see if there's any attendees yet. 3 live out of 16 registered.
So we need to do it where we're centered? Is that what you're saying?
Somehow. So there's 3, which is probably Shayna, you and I at the moment.
There's 6 now.
Oh, it keeps
So
going.
let's turn this. So this is how we're up.
Yeah. Kissing.
Okay.
Might as well close that door so we don't get any noise.
Let's see. Just for a second. At least my ones. I'm just wondering if they could see your hair. Be helpful.
Feel like singing?
Yeah, let's sing a song.
Sing, sing, sing. Sing-a-ding-ding-ding. All right, we've got we got about 5-6 minutes here before we rock and roll. All this newfangled stuff. Give me the couple sheets that I have on top there. Do you have something on the back of the one?
This is the only one of yours not on that.
Okay. Well, who's that?
She's not going to have voice in the presentation. She's got her audio off.
Well, you know what? I think I'm going to go ahead and start the slide. All right.
You got to click the left side here. Trackpad, you're clicking the right.
Yeah. Then our pictures are down below.
Hold on, let me look at something real quick. Is this what it looks like with us to them? You see how we're not showing?
I'm not sure if it does or not.
Everyone can see what I'm.
Yeah, he started it.
No, it's really.
Yeah. I'll be right there. Can you see us there for the right side? We need to see us.
We're certainly not able to practice social distancing here. So,
Did you move the computer?
nope,
Okay.
not moved anything. Okay. So how do we know when it is to start it?
Whenever it's 11:45. And we'll do an introduction.
Good morning, everyone.
Good morning.
We're happy to be with you today. I hope everyone's doing fine and enjoying all this time you have around the home, the table, sitting, eating together for a change, or whatever you're doing. Welcome, everyone. We're delighted to have a few minutes with you this morning. One of the subjects that came up last year during our focus group was to have some type of educational event centered around emergency preparedness. Well, that's kind of apropos right now. We may be behind the 8 ball on this one.
Yeah, we should have done this a few months
Should have done it a
ago.
few months ago had we had hindsight there. But nevertheless, we're not expert on subjects at all, but we're going to talk about some of the things we researched and found out. We're centering around 3 topics of emergency preparedness. First being medical, physical, and then financial. So we'll be probably speaking for about 15 minutes, maybe 20 minutes. I don't know how long.
Yeah,
Depends on if we get carried away.
that's right. Never
But if
know.
anybody has any questions, there is a chat box there. You're welcome to put a question in there. Shayna's on board. She's looking at the questions and comments, and if we have some time, take some time towards the end. If there is some questions, if we can answer them, we'd be happy to do it. But nevertheless, let's dig right in. The first topic this morning will be the medical part of it. We have to show you all these wonderful disclosures. You guys are all aware of that. But there's simple tips that we can follow. This was based on some information we got from ready.gov as part of the Homeland Security website. The first thing we need to do in any circumstance is get informed. We need to learn all we can possibly learn about things that we can do to prepare ourselves for emergency, whether they're physical emergencies or medical emergencies centered around that, or financial. It's good to learn something about it, but then we need to do something. We need to take an action. We need to make a plan. We learn a little bit, put a plan in place on how we're going to handle things. Maybe it's something as simple if something happened to us, we're on the road, we have a flat tire, or we're on the road and we can't return back home because of a storm. What kind of contingency plans can we have in place? So talk with each other, talk with family members, try to define what your plan would be, and then start carrying out the plan. Start, if you need to buy things, supplies, making kits or gathering information to complete the task. Begin doing something. Start small so you don't get overwhelmed. That's important. This is information that's been given out for years. I think we're all pretty much aware of that, so we don't necessarily get around to doing all we can about it to make ourselves ready for most situations. Here's some basic ideas to consider when becoming informed, making a plan, and carrying it out. The first thing we want to talk about for a few minutes is health. Over the years, we've had a conversation or two about this. Carrying your important information around with you. We have available these ICE keys. It's in case of emergency. That's what ICE stands for. We have these keys available for everybody that's on the webinar today. We'll send these keys out to you. I'm going to go through that in a moment or two and show you what's on it, so you know what is on it if you have not seen this before. But anyway, it has medical information on it that you should give. And why is that important? Well, the leading cause of death in America is heart disease, then cancer, and the last one that's noted here is preventable hospital errors, and the majority of those errors are complicated by not having the complete knowledge and understanding of medications that the patient's taking. So they'll prescribe things that will not correlate well with something the patient's already taken. So drug interaction is an important thing, and also another cause of this death, preventable hospital errors, is plain handwriting. We need to slow down our practitioners so they write proper notes. So anyway, these things are things that can be preventable. And so one of the ways that we want to help you guys is to get you organized with the ICE key so you can put your information in there and be prepared if something were to happen to you. The bottom line is there's a few other documents that you can put on this ICE key, and I'm going to bring that up in a second, but HIPAA laws has restrictions. You've got to have permission to be able to get information about a loved one. If you got college students, grandkids or whatever away from college, and they end up in the hospital and need care, really, since they're over 18, in most cases, even the parents can't get involved in their care unless there's some type of directive on hand. Sometimes we have second marriages, and maybe we had all those things taken care of, directives and things in that situation, but now we get a new wife and we have to start all over again. So it's important to understand that HIPAA laws will restrict loved ones from being involved in care. And right now, the circumstances we have in our country today with this pandemic, we can't even visit folks in the hospital right now. So that's restricting very much so the ability to interaction and help and be involved in their care. You can do this if you properly prepare, and the ICE key has a format where you can actually load all this information on the key itself, and that can be on that person, probably on a set of other keys, so that's prominent when they start looking for things that the person is incapacitated, so they can get information, or you can simply present it to your doctor. I think I have had clients tell me in the past that they give it to their doctor every time that you go to the doctor. They want an update on your medications and etc. Well, if you got everything on your ICE key, they ask if you have a healthcare directive when you go have a procedure done at the hospital all the time. Well, you can show them the digital file and they can get it that way. So it's a good tool to have, and we'll have those available for everybody today. So what's on the key? Medical information, lists all your prescriptions. Insurance plan information is there. Yeah, I have mine. I'm going to show you a list of the documents in just a second. Emergency contact information, instructions to upload living wills, or you can actually put your living wills and power of attorneys on there if you feel safe enough to do that. So I'm going to pull a document up real quick. I'm going to go down here to the come out of this particular file and come over here. We learn how to do this. Let's see here. Okay.
Nice key document.
Here we go. Now you'll see what I just pulled up, folks, if you want to look at it, is that this is information that comes with the ICE key. We'll make sure everybody gets it. It's a complete outline of all the different things you can add on there. It's in a format where you can type it in right from your computer. If you give you the document, you can print it off, type it in, or write it in, whatever you need. But you actually load that information in. When you push the key into the computer, that file comes up and it's writable, so you can fill in the information that's line by line as you go through that document. So that document's there for your sharing. We'll make sure you get that hand copy, but it's also already implanted on the ICE key, so you can facilitate putting the information in it real easily. Okay. All right. For the next few minutes, Daniel's going to talk about some of the physical things we can be doing to prepare. Remember, at the end of the program today, everybody that goes in and listens to the whole program, we're going to have a drawing, and we're going to be given a 72-hour kit, and we'll tell you a little bit about that in a few minutes. So physical is our next topic. Daniel?
All right. I wanted to also mention that Bill and I are not experts in emergency preparedness, but we wanted to just give you some resources where you could do a little bit further investigation and kind of get the groundwork laid for the types of things you could do yourselves at home. Some of the basic things you want to take care of in an emergency are obviously your physical well-being. That's going to be a little bit different for everyone depending on where you're at and what type of emergency you have. But here's a couple of things that we think are important for people to have in the case of an emergency to be able to meet your physical needs. One is a 72-hour kit, which Bill mentioned we're going to give away to one of you lucky people at the end of our presentation. What a 72-hour kit is, it's a kit that'll give you enough food, things like that for 72 hours in the case of an emergency and other things you may need. But in addition to that, you need to have some type of long-term food storage, and there's some great companies out there that offer food supply and storage that you can store. Excuse me. One is My Patriot Food Supply. I've actually purchased a 30-day food supply from them. It seems to be pretty high quality. It stores for years. So having a longer-term food storage would be important, at least 3 months worth, but at the very least a month for each adult and child in your home. An emergency car kit, something else on the list. That's if you aren't able to get home. Let's say you live somewhere, maybe you live near the beach and the road is washed out and you don't have any way to get home. It might be smart to have some things in your car, maybe some blankets, ways to keep warm, a flashlight, things of that nature in order to be able to, That's what I thought. In order to be able to have your emergency kit in your car. Next thing is water storage and purification. Having access to water is the most important thing. Now, where I live, I have a well, unless I don't have electricity, and then you have to have a way to get the water. Having water storage and purification, a way to do that would be super important if you were to go without electricity or things like that for a long period of time. The next is an emergency communication and evacuation plan. A lot of schools will have these. A lot of businesses will have one. What would you do in the case of an emergency? If you have kids or grandkids, knowing their plan, if there's an emergency, how would you get them home? Where would they go? Growing a garden. I think a lot of people are growing gardens there. I know I heard in Georgia more people are buying chickens now than they ever have and having their own eggs made there. But having a garden is a good thing to do. I would also add to this list a generator. Having an electric generator would probably be wise. I know where I live, for the last 2 years, we've gone 5 to 7 days at least each year with no electricity when the power goes out. So I bought a generator. And a generator would probably be a smart thing to have if you thought that you live in an area that's high risk where you're not going to have electricity. All right, so here's 4 ways you can start to prepare today. You can prepare every day and do a little bit along, but you want to make sure that you're prepared for emergencies, but you don't want to get overwhelmed with all the information and products that are available. It's impossible to know exactly what you're preparing for, but some of the basics that we just covered would cover your physical needs. If you're starting out, here's a few suggestions that you can use for your family. Number 1, and this is something that we are a little bit more expert in, and getting your finances in order. You want to make sure that you have sufficient savings. We see right now, people in the face of this pandemic, a lot of people are suffering. They still haven't gotten their checks yet, some of them. And so we need to have some savings put back in case emergencies like this. 30% of Americans have no savings at all. And so they're in a bad situation whenever we're not able to have income. In addition to having your finances in order, we would recommend having emergency supplies that will cover your basic needs for at least 72 hours. That's a good starting point. Once you do that, you can move on to some more of the in-depth things. See what Shane is saying here. A 3-month food supply is also an important part of your plan, making sure you can cover your daily diet needs as well. You want to have that. And I would also add, people ask me this all the time, well, should I have any cash at home in case the bank's closed or things of that nature? And it's not a bad idea to have some. The question is, do you have a safe place to store it? And you want to make sure that you do. So the next thing we have to do is determine what type of an emergency are we preparing for. That's going to depend on where you live. Now, around here, I think not having electricity is probably a bigger thing. Maybe that's just because it's happened to me several times. But tornadoes happen a lot. I know people that have tornado shelters. Some people, they sell them now, where you can buy this container and put it in the ground out next to your house or back in the woods or wherever, and you can go in there in the case of a tornado. That seems to be a common thing around here. Power outages, interruption in water and sewer, those are things that happen quite frequently. So again, having the 72-hour kit, having water, and also having a generator for electricity if you're out for several hours, especially if you live in the summer. During the summertime in Georgia, not having air conditioning, that can be life-threatening. if you stay in a house where it gets to be 90 degrees, and it could be a bad thing. So you want to be able to have air conditioning, and you can't do that without the right type of generator. So you have to prepare to stay in your home without water, power, and heat. So some of the things we can do. So focus on the essentials: food, water, shelter. These are basic principles in natural disasters. And again, many times people go for several days and sometimes weeks without electricity. So we got to make sure that you have at least a 3-day supply of food. And hot climates like Georgia, you might want to consider more. How are you going to cook without electricity? You got to know how to do that. So these are some of the things. And then in the wintertime, having blankets, other sources, flashlights, lanterns, batteries for power outages, and then keep a list of these things. And we're going to give you some resources too, where you can go to some really good websites that outline and go into more detail about how to prepare. So first aid is an important thing. If you have a ready supply of your basic materials and medicines, you want to make sure that your medicines, some medicines need to be refrigerated, others can't get too hot. You certainly don't want your medicines to get wet or anything like that, but make sure you have supply of medicines, and that's something you're going to make sure you have. And you want to be able to do CPR, so it's probably a good idea to know the basics of that so you can provide first aid if that were to be a situation that you needed to do. Nothing's going to make you feel better than knowing that you have some type of plan in place for this. And so those are some suggestions that we have for you to get started. In addition to the financial, there's several things you can do. You want to make sure you get out of debt, build your savings, live within your means, have a budget, keep some cash at home in a secure place. Another thing is to understand how your insurances work. Some people think that they have flood coverage, for example, and they don't. And their home gets flooded, and then they're not going to get the insurance payout that they thought they did. So if you own a condo at the beach, make sure that you have an understanding of how your insurance works there, what type of how you would interact with the homeowners association, what kind of things are they going to help you with. So understanding those basics are super important as well. All right, so that's a little bit of an overview for everyone, but here's 4 websites that are very in-depth and can really do a deep dive into what we've been talking about today. FEMA.gov, everyone's familiar with them. The CDC, if you go there, you can just click on where it says Aging and Emergency Preparedness. We'll also send a link out so you can see these as well. Ready.gov, that's a real focus on emergency preparedness for seniors. And nsc.org. So those will all give you a lot more information in depth than even that we've covered today. So hopefully that's been helpful to you. We're going to now see if we have any questions here in the chat room. Let's see.
Okay, we do have one comment here that was probably a good idea. It says an idea for training topics in the future might be CPR training.
Yeah,
we agree with that for sure. You know, I don't even know how to do that. I'm shameful to say, but I do have children that do, thank goodness, but I probably should learn how to do that. Let's see here. Reposition the camera to who is speaking. A little late there, huh? We should have checked that one out a little while ago. Sorry about that. Okay, let's see. Okay, let's see. I guess that's, is it back up? It's bad weather. Scroll down, see if there's no sound. No, we got, I guess we're okay. Good morning, good morning, good morning. Good morning to all y'all. Good morning from Texas. Okay, we've got somebody listening from Texas today.
Hopefully better.
Good morning. Good morning, all you folks. We're glad you're online with us today. Back to some of these things we can share with you here for a moment.
Slideshow, right?
Yeah, we can stop this now. Everybody's got that. We're learning as we go here. Here's a Georgia healthcare directive. We talked about sharing that as well. This is just a template for a healthcare directive. Folks, you know, healthcare directives is basically how you make well known what kind of care you want, and hopefully most of you already have one, but you may have family members that don't. And, you know, even though they're not aged, they still could have accidents and illnesses that require medical care. And having a simple healthcare directive is certainly worthwhile. This is a template. We're not advocating you use that. You probably ought to have an attorney draw it up. But if you have desire to get that template, just let us know and we'll get it to you. The next one down here we'll share will be this is a HIPAA form. You sign these forms all the time. You can't get information on anybody without a HIPAA form anymore. So that's a good piece to know how it works and understand it. And then we have our drawing for our 72-hour kit. This is a pretty comprehensive kit. As I remember looking at some of the details that were in there, I think there may be there's some food and water in there. There's some tablets that as well for water. I think there's a battery held, a hand crank type of light, a flashlight in there as well. Some warming blankets. I think there may even be a small tent in it. I don't recall all the details. But anyway, it's a good little a kit to have. We have a couple at our home and never had to use them, I think, but we got them if we need them. But what's that? We had one more question. We had one more question here. I'm sorry.
So we had a question about how much cash to keep at home, and of course that really just depends on if you have a safe place to keep it. You don't want to just keep cash laying in a drawer. You need to have a safe or something like that, a place to keep it, a fireproof safe. But I don't see any reason to have more than $1,000 to $2,000 at home. But I certainly see a reason to have that. If you're able, what if there is a natural disaster and you aren't able to, go to the bank? It's going to help you to have some cash on hand, but no need to go overboard. But having between $1,000 and $2,000, I think, would be appropriate.
Okay, everyone. I guess we have a list of everybody that's online and listening today, and we're gonna draw out the 72-hour kit, and what we're gonna have done is have it shipped directly to you, so that we don't receive it and then have to resend it to you. So Alicia will let you know the details about that. We're going to tell you who won it right now. If there's a husband and wife on there, you both get one. That's the way it works. If it's singles, you're going to get two. So whatever, you get two. Give it to a friend, a family member, whatever you'd like to do with it. So we're going to give away two of them with one name. I guess that's what it is. So Daniel, grab a hold of that. Let's see who we got here today.
All right, I'm not going to look.
You're not looking?
I'm not looking.
He's not looking. All right, so who's our winner today?
Dodd Hamlin.
Dodd Hamlin. That would be Casey and Dodd Hamlin. So apparently you're there today. We're glad you're on there. So we'll be sending out those kits to you. If anybody else wants to know where we secured the kit from or want information about it, Alicia has a handout about the kit and all the content that's in it. They're reasonably priced, so it's worthwhile to have around. If you're traveling, you may want to throw it in the back seat of your car just to have it, or in your truck or whatever. But we hope this has been helpful for you. We enjoyed doing it. Looks like we got one more question here.
Yeah, we had a question on, do we have an emergency inventory checklist? And those 4 websites we listed, they have a lot of those checklists listed right on there. The CDC.gov, ready.gov. You'll be able to pull checklists and inventory checklists from those websites. And so we'll make sure that you have those resources.
Yeah, Daniel, I've got a printout I printed when we were researching from Department of Homeland Security. It's entitled Ready Check. It's called Build a Kit, Basic Disaster Supply Kit. It has all the what should be in the basic emergency supply kit: water, food, battery powered, crank radio, some type of radio that you can get a weather channel on, a flashlight, first aid kit, extra batteries, whistle, a signal for help, a dust mask, plastic sheeting, and duct tape. Duct tape's good for anything to shelter in place. Moist toilets, if you can find any right now. Garbage bag, plastic ties, wrenches or pliers, manual can opener. I don't even know if anybody knows how to use one of those anymore. Local maps, cell phone with chargers and backup. Then emergency supplies. You got one of the most important things is to make sure you have some extra meds, prescription medication, non-prescription medications such as pain relievers, etc. Anything you take on a regular basis. I don't think any of you folks need to worry about infant formulas and things of that. But if you take pets with you, got to bring pet food, cash, lots of other things, chlorine bleach, fire extinguisher. A lot of the food that works real well in this is freeze-dried type food. So there's a lot of information out there. We do have some, and if there's anything you do want, just request it, and we'll get Alicia to get it to you. Does anybody any other questions today? Well, we're going to get the social distancing problem, but we're going to lean in here to say goodbye. We enjoyed meeting with you folks today. Take advantage of our upcoming seminars. Next week, on Thursday next week, we're going to be doing a CARES Act educational event about the CARES Act and how it may relate to you and your family. And we also are doing a live seminar next Tuesday that we're marketing to the public. And we'll also let you know about that if you want to join or bring some of your friends.
Double token.
So if you have a friend that logs into it and participates in it, we'll give you double tickets for our drawing. We still have a referral program going on. Anytime you refer somebody to us, you'll get tickets for the drawings. We appreciate you guys. Y'all stay safe, and we'll be talking to you again. Thanks very much.
Thank you.